Crespo, and I'm here to talk to you today about antibiotics. How many of you have taken antibiotics at least once in your life? Whether it's been for an ear infection or a sore throat, I'm sure most of you have. But have any of you actually researched antibiotics and its effects? Many people have taken antibiotics at times where they're ineffective. Today I will be talking about antibiotics and how if taken incorrectly, they could negatively impact your health. This way you can make better informed choices about your health. According to the CDC, 1/3 of people use antibiotics incorrectly. Medline states that antibiotics are medicines that fight bacterial infections in people and animals. In this speech, I will answer the questions: Can taking antibiotics wrong lead to consequences? At what times should you be prescribed antibiotics? And how should you correctly take your antibiotics? Antibiotics are the most commonly prescribed drugs and can be mistaken even with a doctor's prescription. First, can taking antibiotics wrong lead to consequences? Incorrect use could lead to antibiotic resistance, described by the CDC as when germs like bacteria and fungi develop the ability to defeat the drugs designed to kill them. This could be dangerous as your body builds up an immunity to the drug and becomes ineffective, and antibiotics can no longer help. Depending on the person's medical history, certain antibiotics could lead to an allergic reaction. Not sharing all of your allergies with your doctor could lead to some mild reactions or even require a hospital visit. Even if you have shared all needed information, there's still a chance that something could go wrong with your antibiotics, which could lead to nausea, dizziness, a rash, or even diarrhea. Antibiotics could be helpful in making you feel better, but when is the right time to use them? Next, I'm going to cover at what times you should be prescribed antibiotics. The purpose of antibiotics is to treat bacterial infections and not viruses. Illnesses like COVID and the flu are viruses, and treating them with antibiotics would not work. Using antibiotics to treat viruses would only build up your immunity and would cause antibiotic resistance like I've discussed earlier. The only time the antibiotics would be beneficial are in bacterial infections. A urinary tract infection is a bacterial infection, and treating this with antibiotics could help stop the infection. Antibiotics should be utilized at times where a person is considered a high risk for an infection. This could prevent a person's condition from worsening as they've prevented a bacterial spread, allowing the person to live a happier and healthier life. Here we can see viruses and bacteria that can be treated by antibiotics, and the bacteria are strep throat, tuberculosis, whooping cough, UTI, and some viruses are the common cold, flu, and sore throats. When being prescribed any medicine, it is easy to hope for the best and not consider what you're putting in your body. I will cover how should you take your antibiotics correctly. You must take the full dose that the doctor prescribes to you, or again, this could lead to antibiotic resistance. Following doctor's orders could help in the long run. Even if you begin to feel better, it is important that you finish the medicine even if you are no longer sick. Drinking alcohol could cause your body's immune system to weaken, so drinking alcohol and taking the antibiotics at the same time could counteract with the medicine, making it not work. And this could also cause liver damage since your body's immune system is weakened. When your doctor orders a prescription, avoid drinking alcohol. Do not use other people's antibiotics. It could be difficult to know what type of illness you have and how to treat it. You could have taken the wrong antibiotics to treat a virus and end up doing the opposite of helping. In this statistic, 496 people, out of those people, 48.2% of them reported that they kept their leftover antibiotics, and of this 48%, 72% of them gave them out to siblings and other children without doing their research. Antibiotics might not help when needed by doing this. In this speech, I have covered knowing what the misuse of antibiotics could lead to, knowing at what times it is appropriate to take your antibiotics, even at times when they're prescribed by your doctor. You should do your own research to make sure that nothing was overlooked. And I will also cover how to correctly take antibiotics to better your health and stop infection. People should learn to take antibiotics correctly and should understand the risk involved with antibiotics. Taking control of your health and being aware of how to help yourself live a happier and healthier life. Thank you for taking the time to listen to my speech. I hope that you can take what I have talked about today and use it in your next health choice.